Dear friends, this is Dr. Ibrahim, and I want to present a new video for you that relates to COVID-19 and its variant, and the more concerning variant now, Omicron B11529. Let's talk about it briefly. This variant has originated from South Africa, and we found this variant and with the patient hospitalized in South Africa in the month of November. And at this time, when I'm talking to you on December 2nd, this virus has traveled to 20 countries of the world. As far as a report of WHO and CDC is concerned, we are not aware much about this virus. This virus infectivity, transmissibility, and whether it is a deadly virus, what kind of effects it can leave on the human body, we don't know much about that. Why we don't know much about it? Because we don't have enough data. Very small number of people have been affected by this virus, and since we don't have enough data, it's hard to comment about its pathogenicity, about how deadly and how it is going to react, right? In US, we found the first case in California last week. The patient has been doing the self-quarantining and the close contacts of this patient have been found and tested negative. The patient is having mild symptoms. This patient had been vaccinated, and so the symptoms are mild. And so far, the patient is recovering well. And we don't know about other cases in South Africa, but the news that came to us so far, it was not found anything deadly. So far, we have the mild cases. But how this virus is going to react, how this virus is going to make an impact on the human body, we don't know yet. But you know what we can do? On our end, we can take care of the four things. These are more important to me. Number one, face mask. Yes, age 2 years and older people should wear face masks while they are in the public setting or going outside of their home where they have more people to come across. Number two, vaccination. Yes, 5 years and older people should get vaccinated, and they should consult their health professional which vaccine would be good for them. Those people who already receive the two vaccination, like for Moderna, they receive 2 doses, for Pfizer, they receive 2 doses, they should consult with their health professional for their booster dose. Yes, now booster dose is very important. So consult with your health professional. If there's a gap of 6 months or more, whatever the advice of your health professional, please get the booster dose. Number 3, social distancing. Yes, it's been observed that people are now careless. They are not caring about the social distancing, but now you should care for the social distancing. That is the third important thing. Number 4 is hand washing. Yes, it is very important when you go outside to a mall, grocery store, meeting your friends. When you come back to your home, make sure you do the hand washing. And not for you, but also make sure all your family members take care of that. Do the hand washing while they are back home, right? So I'm going to wrap up with the 4 important points again, so you don't forget and re-emphasize and remember all these 4 things. Number 1 is face mask. Number 2, vaccination. Number 3, social distancing. Number 4, hand washing. Hope I have given some brief clue about this variant Omicron, and whatever the knowledge I had until today, December 2nd, I wanted to provide you. Don't be panicked, but be proactive to face this virus, which might be deadly, which can leave deadly effects. Who knows that? Nobody knows that. So be careful, watch news, watch videos related to the COVID-19 and Omicron variant, and take care of yourself and your family. So whenever I have more information, I'll make another video related to Omicron and will provide you and update you with the latest information. Okay, see you then. Take care. Bye.